Okay. Week 11, chapter, I'm not sure the number, but it's on health. Slide 31. The underinsured, having insurance but inadequate insurance, the results of which can be it's expensive and the care is poor. Slide 30. Social determinants of health alter. This is what we have been discussing. Slide 20. What is it? 9. Essential health benefits. This was part of the Affordable Care Act, otherwise known as Obamacare. I guess it was not repealed. I'm not sure how states are implementing it now. But yeah, the health exchange is still there. 20, what is this? And it's listed here. All of it's listed here, what health insurance programs have to have. People have to buy private insurance. There is public insurance for poor people, but we do not have a universal health care single payer system by the government like other countries do. 28? No. 27. Reimbursement rates. So Medicaid for poor people by the government reimburses doctors at 75% the rate for Medicare for old people by the government. And Medicare, I don't know if it's good or bad reimbursement as it is. I'm not sure if it's legal for a doctor to refuse services from a person just because they have Medicaid. It might be, though. In certain situations. 25. The UN Declaration of Human Rights, I guess they are relating it to HIV/AIDS patients, and prejudice and discrimination and confidentiality. 24. Decriminalization. So this is the reversal of the criminalization process we have been discussing. And what? I'm not sure if this works, though, because, again, it's about the person, not the crime. It's about the group, not the crime. So maybe it'll just transform racism in another way. I'm not sure. Portugal has decriminalized much drug crimes to now be administrative offenses, although they are still not legal. Drug use is still not legal there. 23. Gender affirming care for trans persons and trans youth. Only 1% of youth seek gender affirming care or are transgender or gender non-conforming, non-binary. Only 1% of trans persons ever detransition also. Here they mean puberty blockers while a person is deciding, hormones like testosterone or estrogen to be more male or female in development and appearance. Only 1% of adolescents have any surgical interventions. It's for teens, and the common one is the top surgery for trans men. And there's a bunch of statistics on this. So, I mean, there's a bunch of scare tactics out there. So do your research if you're curious about it. It's not like what conservatives say, frankly. Um, Slide 22. This is actually about postpartum depression is a serious condition affecting women who have just given birth, but this is about SNAP, Supplemental Nutrition Assistance Program, otherwise known as food stamps, and EBT, Electronic Benefit Transfer System. So the credit card, instead of they used to have like little paper, almost looks like Monopoly money and stuff like that you could use. Anyway, Oh, and WIC, Women and Infant Children, also a nutritional assistance program for children to 5 years of age and women within that 6 months. Yeah, 6 months postpartum after giving birth. Okay, 21. I just mentioned this, so yeah. What is this about? Well, I mean, other countries spend less on healthcare and get more for it than we do, and they all have this. So why should we not have this? Would be the argument. I mean, I know they scare old people by saying they will ration care and give medical care only to young people, not to old people, if we have government health care. But the truth is, business insurances, medical insurances do that already based on who can pay and who cannot. What is this? Slide 10 should be here. Okay. Maybe I'll come back to that one. Slide 9. Health is multidimensional, and it uses this definition of well being that comes from positive psychology and humanistic psychology that deals with mental, physical, emotional, social, environmental, financial, and spiritual health. Slide 8, health insurance. Basically, insurance companies put profits over people because they get paid for denying care. Mm, slide 4. Hmm. Prohibition. Drugs can be harmful, but prohibition is also harmful. We would recommend using a medical model to treat substance use disorders rather than a criminal model to punish. Slide 3, medication assisted treatment. These are also controlled substances. They do work, but there's a stigma around them, which I will, well, okay, so for example, there's this drug called, it's on the next slide. What's it called? Naloxone? I don't know how to say it. Anyway, it's for drug overdoses and it saves people's lives. However, um, when the opioid crisis, well, I mean, okay, so when this drug was first introduced, there were counties that did not buy it for emergency services, even though it's cheap, because they did not want to encourage people, I guess, using drugs in their county, and so a lot of people died who did not have to. Um, there were counties in Ohio where it was drug overdoses were the number one cause of death for a while, even above cancer, heart disease, diabetes, obesity, whatever. Because they just viewed these substance users as not human, basically, and as not citizens, and as if their lives were not worth saving, even though there's people who've overdosed multiple times, lived, and then were able to enter drug cessation programs, rehab successfully, and not go back to using drugs. This relates to slide 2, harm reduction policies. So that would be an example of a harm reduction policy, but also needle exchange programs for drug users to prevent the spread of HIV/AIDS. Although, again, there's the stigma, and you know, people say, "Oh, it encourages drug use," but it saves lives also. avoidable death. These could be due to lifestyle, environmental, or socioeconomic conditions. Um, we have acute medicine in this country instead of preventative um, medicine. So instead of getting regular checkups, because a lot of people don't have health insurance or a doctor, people seek emergency care only when they get really sick. And again, that's really expensive and leads to poor health outcomes because with things like heart disease or cancer, it's better to get regular care from a doctor, preventative care, rather than acute care. Only other thing I can say about this is that, the war on drugs has basically been a war on poor people and people of color. Um, the CIA was funding drug cartels so that it could finance its wars with communist countries in Latin America in the 1980s. Meanwhile, the FBI was funding the war on drugs. So, I mean, the US has been on both sides of it. Um, and people wonder, well, why is there immigration from Latin America? Well, this is part of it. The US has funded drug cartels and um, anti communist dictatorships that have made life hard to live in those places. Um, okay, what else? I mean, there's the prison industrial complex, which incarcerates a lot of people and also provides jobs, for people like correctional officers. And there's the military industrial complex, which is based on war profiteering and provides jobs for soldiers and so forth. Um, a lot of money in both of them, a lot of big money. Um, and of course, a lot of older people, disabled, poor, people of color, and queer people get incarcerated, and young people. We warehouse people. Instead of providing social welfare services to people, we just put them in prison, basically, when they cannot take care of themselves for whatever reason, because I guess welfare programs are viewed as rewarding people in our country, and most people would prefer to punish people through the criminal justice system.